This is a fantastic question. If you are a patient with cancer, why do you have to have two different surgeons treat you? Why do you need one surgeon to remove it and one surgeon to reconstruct you? So the first reason why is going to be training. So as you were saying, I am a general surgeon as well. So I do have full general surgery training, but not all plastic surgeons do. So if you do a combined or integrated program, you only have a few years of general surgery and you would not be eligible for your boards. Some hospitals would not allow you to do certain types of tumor removal. The second reason is that the goals of the two surgeries are quite different. So when you remove the cancer, you want everything gone. You don't want to leave anything behind. When you're doing the reconstruction, things look better if there's more left behind. And so I don't think any surgeon would do this knowingly, but you would worry subconsciously since the goals are different. You would potentially not be making always the best decisions for your patient. The next reason is that the fields are huge. So oncology, surgical oncology, and then reconstructive surgery are two massive fields of medicine that are ever evolving and changing. It would be very, very difficult to stay on top of everything in both fields. So it's not unethical to do both, and there are surgeons that do that, but they tend to stick to one area. So in plastic surgery, you may see plastic surgeons who also are general surgeons who do breast cancer treatment and reconstruction, or skin cancer treatment and reconstruction. But it's not common to see someone do colon cancer treatment and perineal reconstruction. That's not common. It's almost always two different surgeons. I have known a handful of thoracic surgeons that do their own latissimus flaps. I'm not a big fan of that, but it does happen. So that's kind of a quick review of why most of us don't do both, and we like to choose our area and stay there. For me personally, I also just love my role as the plastic surgeon because I am the one giving the patient something back. When everyone else is doing something to them, I get to give them something back, which is nice. I also like my role as a communicator and kind of a health translator. Your relationship with your plastic surgeon tends to be much longer term, and you see them more frequently than you see the other doctors that are involved in your cancer treatment, and I just like that role. So for me personally, I prefer to stay right here as a plastic surgeon and not delve out into other areas, even though I am qualified to.